I'm Kelly with Whittle Advisors. Today, we're going to talk about CMS's broader strategy at play. In previous MACRA videos, we've talked about what MACRA is, what MACRA isn't. We've given you insight into the 4 performance categories that are going to compose your score for MIPS. We've talked about the 2 tracks, MIPS and APMs. Well, today, we're going to take a step back and take a look at the broader strategy to managing the healthcare of our populations. Let me show you what I'm talking about. You'll see on the far left-hand side, under Category 1, we used to operate in fee-for-service, purely fee-for-service. As we move from Category 1 to Categories 2 and 3, that's the middle section, in the red bracket. Note that I've added those red brackets for clarity. This is the area that MACRA plays. In fact, Category 2 most closely aligns with the MIPS track of MACRA, while Category 3 most closely aligns with the advanced alternative payment models associated with MACRA. And very clearly from this diagram, you'll see that MACRA isn't the end of the transition. MACRA is required to move us from fee-for-service to the management of population-based healthcare. The reason I bring that up today is we're already finished with the first quarter of 2017. Many of you will be formulating or researching your MACRA strategy for 2017. I want to call to your attention the fact that the concept behind MACRA will not be fulfilled by completing a list of tasks. MACRA is a concept change. You need to be aware that unless you change your underlying operational model, you will not achieve the intent of the MACRA regulation. So let's break this down. In order to implement the intent of the MACRA regulation, number 1, you must be using the appropriate certified EHR. Your technology must be 2014 certified or 2015 certified, but that's not the end of the line. You also must understand the intent of quality measures. There is a plethora of quality measures under MACRA. In fact, there are over 200 quality measures to choose from. The key here is not just collecting data for data's sake. The idea is that you would start to hone in on certain conditions or procedures within your medical practice, and that you would develop a framework that allows you not only to engage with your patients, but to follow up with them at a future date. That operational change is very key to moving us from fee-for-service to the management of population health in the future. You must hone in and develop the ability to track and provide guidance to your patients without your patients initiating the conversation. The third thing to be concerned about in this year of MACRA is utilizing the amount of time that we have in 2017 to your advantage. In any change initiative, the key to success is allowing yourself enough time to develop a strategy, to implement the strategy, and then to stabilize the strategy. And that's really key. Often, those leading change forget to allow for a period of time of stabilization. Now, you might be asking me, what in the world is stabilization? Stabilization is the time when you implement a new policy, a procedure, a service line, a business area, and you determine if your plans and your approach are actually effective. Make sure that the change you were intending is actually sticky enough to repeat over and over to produce success. If you find that you have questions about your MACRA strategy or how to make your changes sticky, I invite you to reach back to Whittle Advisors.